Oral minoxidil. What is the buzz surrounding oral minoxidil? Well, of course, minoxidil was a drug which was used for hypertension, and the side effect of minoxidil was hair growth. So that is how minoxidil was actually discovered. And people were using a very high dose for hypertension, that is 10, 20 milligrams or even 40 milligrams orally. And then of course, we invented topical minoxidil, which is typically used in 2, 5, 10%, and it helps in hair growth. The problem of topical minoxidil is it is mainly alcohol based. It leaves crystals on the hair which look like dandruff. The delivery substance, which is where minoxidil is attached to, is alcohol. So it makes the scalp irritable, dry. It can give some headache sometimes, heaviness. It may also cause a bit of frizziness and breaking and hair breakage. So hence oral minoxidil is safer. Low doses of oral minoxidil, which is as less as 1.25 to 2.5 milligram, are very safe. They can be taken by any patient of any age group, and they help a lot in hair growth. Also remember one more thing, that minoxidil typically has to be converted to an active form, that is minoxidil sulfate, and this depends on an enzyme which is present locally in the scalp. If this enzyme is less or deficient, then the conversion into the active form won't be that much. So the potency of minoxidil will reduce. But if you take the minoxidil orally, then it automatically gets converted into the active form minoxidil sulfate by the enzyme which is present in the blood and in the liver. So hence you get a more active and a more potent form of minoxidil if you are taking it orally. And these are the big advantages of oral minoxidil.